Don Paolo, and I'm here today with Dr. Garnet Watson. Now, one of the really cool things of why I went into nursing and went into healing is I wanted to be exposed to how the rest of the world really approached it, and very different to how I was sort of trained traditionally in the hospital setting. So, Mr. Watson, tell us a little bit about yourself.
As Don said, my name is Garnet Watson, doctor of Chinese medicine. I've been at this now for approximately 20 years. I was always intrigued in sort of complementary or alternative medicine because I saw mainstream as a very narrow facet of well-being. And so organically through my life, I was involved in sort of the first aid, much like you were doing with the nursing. So it was critical interventions, and as that evolved, I reached a crossroad where I could look at either going sort of the allopathic model, becoming an MD and treating people in the current model system. But I always felt a short-sightedness on that end. As I watched the previous generation before me using the strategies and seeing more suffering, something didn't ring true. That was the part that I just was really taking where it just didn't ring true. I started to explore sort of the complementary or alternative, as it was called back then, and I came across Chinese medicine, and it seemed to speak to me in that holistic viewpoint of what well-being is all about, looking how the emotions and spirit and everything else are involved in the state of what we would call wellness. And so that was sort of the start.
Yeah, absolutely. And that's kind of one of the reasons why I left nursing and I left that model of traditional healing, because they view the body very mechanically. Right?
Yeah.
And we know, we're all emotional, we're all spiritual sort of beings, and that all plays a role when it comes to how we heal and recover. So explain your sort of the basic philosophy of how you view the body in terms of energy and trying to heal.
Well, in Chinese medicine, we have a qi body, they refer to it. Now, it's a bit of a stretch in understanding sort of this term qi, because we don't have anything in Western medicine that really identifies that component.
Actually, we do. It's in Star Wars.
Oh, sorry.
There's the force, right? The force. And then prana in like Ayurvedic medicine. Like there's lots of names for it. And then Tesla, frequency. Just in the hospital setting, there's not really a word for it, but we are exposed to it, just not as the way we are with qi itself.
Yeah, and I guess what where I'm going with this is that the differentiation is it's actually applied within sort of the medical model or the healing model in a lot of other countries, where here, if we're using Star Wars to treat somebody in the hospital, it's, there's acknowledgement that there's things that we don't fully understand in Western construct. Sort of the Chinese have a model that explains some of the phenomena that we don't really have a methodology yet, sort of Westernly. And so, and they use acupuncture and various other modalities to sort of activate that system. And over the 5,000 years, there's evidence to show that when treated this way, outcome is well-being.
And to me, one of the big things was that as I was not only learning about nursing, I was just so fascinated with both, Chinese medicine and the other sort of Eastern practices. It just really made a lot of sense to me. It was just the same thing, just the different side of the coin, but they were all trying to target the same thing. And to me, it was like, if we just combine the two, because traditional and Western-based healing, it has its place, it has a lot of use, and it's really functional, but for a lot of people, it doesn't quite hit the mark. And, what do we do for the people that Western medicine can't treat? I mean, there's a lot of answers out there that, we want to explore. And, over the next few weeks, we're going to go through and uncover as much as we can and really try to help you out.
That's our goal.
That's our goal. So we'll see you soon, and we'll talk soon.